Right now, then we'll be back to this current conversation where the Kenyan government just this morning is receiving 358,000 doses of vaccines from the Canadian government in order to bolster the nationwide vaccination process. The Permanent Secretary for Health, Susan Mochache, and the Canadian ambassador to Kenya are receiving the consignment at the Jomo Kenyatta International Airport. The PS is currently speaking. Let's listen in.
We continue to get claims of concern that some people are paying to get the vaccine. And I want to take this opportunity to reiterate to all of us that all the vaccines that we have in this country are offered free of charge to the citizens. All the vaccines which are either coming through our friends and partners or through the use of public funds to procure, come and are provided to faith-based hospitals, facilities. They are provided to private facilities. They are provided to public facilities at absolutely no cost. And therefore, it is very important for us to ensure that we indeed report any cases of anyone, whether a health worker demanding for payment or a health facility demanding for payment through our COVID-19 response line, which is the 719. You may also get through to us through the usual ministry communication channels and the several other regulatory agencies that we have within the ministry. As I said earlier, the Ministry of Health has clearly listed all the vaccination sites where people can go and get the vaccine. We've gone further to make this information easily accessible on our ministry website. And in the event that there is any difficulty, we encourage the citizens, please seek these services of knowing where to get your vaccines, either from our website for any additional information, as well as using the 719 hotline, or contact any of the government agencies and medical regulatory bodies that can point you in the right direction. Ladies and gentlemen, as was clearly stated by the Cabinet Secretary in the Ministry of Health, we are working very closely with the private sector. We have made significant strides together in a venture to ensure that collectively we provide vaccines as quickly as possible to the population. And I wish to report to you that through KEPSA, and which my minister had mentioned earlier, they have been able to mobilize $2.4 million US, that is 240 million Kenyan shillings, and this money was paid to a dedicated Central Bank of Kenya account, and the money was wired to the African Union, and out of that, we will be expecting to receive 240,000 J&J vaccines by next week. And really, following the cue of my minister, we really appeal to the private sector to use this mechanism, to use this arrangement to make a contribution in helping us to fast-track vaccination so that we can get back to the business of running the country as normal. I wish to reiterate once again that these vaccines are free of charge. Again, I will not tire to say that they are free, whether in a private facility, whether in a faith-based facility, whether in a public hospital, or whether in a designated vaccination site, because we do designate a site where vaccinations are done as part of an outreach program. It is therefore illegal, immoral for anyone to take advantage of this process for purposes of political gain or for profiteering and trying to get political capital out of a matter that is so grave, a matter that threatens the very existence of our country and our people. It is against this backdrop that we would wish to warn once again anyone attempting to interfere with the vaccination exercise, and to really say very categorically that they shall face the full force of the law. It was very unfortunate what happened in Murang'a, and in respect to the directives that were given by the Minister of Health, Mutahi Kagwe, we've worked very closely with the relevant agencies of government, and just to refresh our minds that certain politicians had mobilized a vaccination drive. So together with other agencies of government, we are happy to report that at least 7 people have been arrested. I'm aware that we are still hot on the heels of the main principal persons behind this, and one of them being a medical doctor. I wish to really assure you that all those individuals that have been nabbed will face the full face of the law for their acts of both omission and commission. And at this point, I want to take the opportunity to most sincerely thank the medical practitioners and dentists and councils, Dentist Council, for the very swift action that they took, which led to the immediate revocation of the vaccination license for the facility in question, which was the Ruai Family Hospital. The lady who handled the vaccines, who is a nurse, she's now being investigated by the Nursing Council, and I have no doubt that she may end up being deregistered from serving as a nurse in this country. So for that, ladies and gentlemen, we want to just urge as a Ministry of Health that we really urge and expect total cooperation from both our healthcare workers and those who are charged with the responsibility of deploying the vaccines from our stores up to our health facilities, and even those charged with the vaccine management at the facilities. We are really making a special appeal to all the healthcare workers to please remain true and faithful to their professional oath that they made to protect and to save lives. Even as I make this appeal, I know that there are so many that are doing the right thing. There are many that have dedicated their time, their effort, made sacrifices to do the very right thing. And to those, we wish to really thank them most sincerely for the very good work that they continue to do. As we receive this donation, I wish to yet again thank the people and the government of Canada for your generous contribution, and to urge all of us here that are responsible and charged with the responsibilities of undertaking the process and of also being vaccinated to do all this with utmost diligence and fidelity to the law. I want to thank you very much and take this opportunity to welcome His Excellency, the Acting Canadian High Commissioner to Kenya, Mr. David Anthony, to also make his remarks. Asante sana. Thank you.
Good morning, everyone. Permanent Secretary and other employees of the Ministry of Health, representatives of UNICEF and the hard work that they do in the country, members of the WHO, employees of the Kenya Airports Authority, and gathered friends. Good morning, bonjour tout le monde, bonjour chers amis, hamjambo. Ever since I was a kid, I've always loved airports. They're very emotional places. You get to say hellos, you get to say goodbyes. Some of the most exciting things in the world in our modern era happen at airports. And today is more proof of this. I have not been on an international flight in an extremely long time, but I'm thrilled to be in the arrivals section of the international airport to welcome probably one of the most important visitors to Kenya in a long time, 450,000 vaccines. No one is safe. For Canada, we strongly believe that no one is safe in this pandemic until everyone is safe. Canada recognizes that COVID-19 poses a unique and truly global challenge. It is in our common interest to work together to defeat this pandemic as a global community. As Canada, we remain committed to global efforts to stop COVID-19 and to address its devastating impacts. If there's one thing that we have realized in the past year, it's that COVID-19 has intensified inequities. It has reversed gains that we have fought hard to win in development and in health, and it has highlighted deficiencies. Therefore, all of us must work together to build back better. Canada has committed more than $2.5 billion in international assistance in response to COVID-19. In line with our feminist values, we continue to focus on those who already experience marginalization more acutely.
So live pictures right there from the Jomo Kenyatta International Airport. Kenya has just received a fresh batch of vaccines from the Canadian government. Roughly over 358,000 doses have arrived in the country, and of course to bolster the mass vaccination drive in the country. We've just heard from the health PS, Susan Mochache, right there, actually highlight that these vaccines are free of charge despite them being dispensed from public or private health institutions. So one shouldn't be in a position to pay for these vaccines. They've been covered for by